let's talk about cancer chemotherapy drugs. So you know that for cancer cells to divide, first of all there should be DNA replication, and after DNA replicates, then there is mitotic spindle formation and those spindles detach, and that completes mitosis. So we can divide cancer chemotherapy drugs into two classes based on the whether it is inhibiting DNA synthesis or whether it is inhibiting mitotic spindles. Mitotic spindles. So for DNA replication, what are the substrates required? Substrates required are purine, pyrimidine, folate. So if you give any drugs that deprives cells of purine like adenine guanine, pyrimidine like cytosine thymine, or that deprives cell of folate, or that inhibits conversion of folate to reduced form. So if you give any chemotherapy drugs that deprives this of purine, pyrimidine, or deprives of reduced folate, then these are called anti-metabolite drugs. Anti-metabolites, because these are metabolites required for, these are substrates or metabolites required for DNA replication, so we call anti-metabolites. And for DNA replication you require enzyme like DNA topoisomerase. So if you inhibit this enzyme with topoisomerase inhibitors, then also the DNA division cannot occur. Another is that there are some chemotherapy drugs that damages DNA by producing free radicals, so directly damages DNA. So those are some antibiotics. And others are alkylating agents. So these two damages DNA. So we have, one is antimetabolite, second is topoisomerase inhibitors, third is anti-tumor antibiotics, fourth is alkylating agents. So now let's talk first of all antimetabolites. So in antimetabolites, for purine synthesis inhibitors, what are purine synthesis inhibitors? These are 6-mercaptopurine, as the name says purine, 6-thioguanine. Guanine is purine. Others are fludarabine, cladribine, hydroxyurea. Next is pyrimidine synthesis inhibitors. So if there are some chemotherapy drugs that mimics the pyrimidines and those replaces pyrimidines, like what are pyrimidines? Cytosine thymine. So there are some drugs that replaces original cytosine thymine with these drugs, then DNA replication cannot occur. So what are the drugs that mimic those? 5-fluorouracil. So this is also pyrimidine. So that replaces thymine. Prodrug of 5-fluorouracil is capecitabine. So 5-fluorouracil and capecitabine. Others are cytarabine, gemcitabine. Third is antifolate drugs. So you know what are antifolate drugs? Methotrexate, pemetrexate. Second, we told that topoisomerase inhibitors. So what are topoisomerase inhibitors? Etoposide, mitojantrone. Another is camptothecin, camptothecins. So these are irinotecan, topotecan, irinotecan. Suffix is tecan, topotecan. These are topoisomerase inhibitors. Now let's talk about antibiotics. There are some anti-tumor antibiotics. So if you see in the suffix mycin or rubicin, it suggests that it is antibiotics. So first let's talk about mycin suffix. So what are the chemotherapy drugs that you know that have suffix mycin? Dactinomycin, bleomycin. Another is rubicin. So drugs like doxorubicin, daunorubicin, idarubicin, these are anthracyclines compounds. So these are also antibiotics. Another is ozogamucin. This is also antibiotic, but this is not used alone. This is used with monoclonal antibody called gemtuzumab as antibody drug conjugate. This is monoclonal antibody and this is ozogamucin. So this antibiotics is combined with this monoclonal antibody. Okay, so these are antibiotics. These are antibiotics, anti-tumor antibiotics. Fourth, we told that alkylating agents. So what are the various alkylating agents that you know? Another one is platinum groups. So what are the platinum compounds? Carboplatin, cisplatin, oxaliplatin. Another is nitrosurea. Alkylating agents include nitrosurea. What are different nitrosurea compounds? Procarbazine, dacarbazine, temozolomide. Another is compounds syncing with mustin, like carmustin, bendamustine, lomustine. Another is compound ending with phosphamide, like cyclophosphamide, iphosphamide. Other is chlorambucil and melphalan. These are alkylating agents. So we talked about DNA synthesis inhibitors, antimetabolites, topoisomerase inhibitors, then antibiotics, and in the end alkylating agents. So these are DNA synthesis inhibitors. So now let's erase DNA synthesis because we have finished DNA. Now let's talk about mitotic spindle inhibitors. So what are different mitotic spindle inhibitors? One is vinca alkaloids. Another is taxanes. So vinca alkaloids include vincristin, vinblastine, vinorelvin. Taxanes include docetaxel, paclitaxel. Paclitaxel is not used nowadays. It is used in combination with albumin, that is called nab-paclitaxel, because it has a lot of hypersensitivity reactions, and even we have to give pre-medications like cimetidine, diphenhydramine before giving these medications, because it is well known for its hypersensitivity reaction. And another is epothelone. Epothelone. This is hexabapillone. So this is the group name epothelone. So if you see in the end suffix -ilone, it means these are epothelone compounds.